So anyhow, Mrs. Sullivan made me aware of an issue that had come up at last month's meeting regarding needles and other undesirable things that may have been found at a school bus stop. And it's an issue that we actually had been already working on over the last few months and getting ready to roll out. And you know, just when you think you've thought of everything, you realize there's something you haven't thought of. And so, you know, we've identified for some time specifically the issue of improperly discarded hypodermic needles as a problem in the city. I'll tell you, it's a problem in almost every community. Stoughton has a huge problem with it. I've heard complaints from Abington, Easton, all of the cities. So it's certainly not a problem that's unique to Brockton, but I feel as though, and I felt as though, it's a problem that we need to take head on, not make believe it doesn't exist, but you know, let's do something about it. So, because of being made aware of that situation with the school bus stop, we expanded our new program to also include school bus stops. So, let me give you an idea of what we're doing, and we've already just begun to do. We are going after this issue of the improperly discarded hypodermic needles on 3 levels. The first one is to proactively be out looking for them in places we don't want them and try to remove them before a parent or a child or someone comes across it. So along that line, very recently, up until very recently, the Parks Department was responsible for removing trash and debris from parks and playgrounds. I've added a couple of employees to the refuse division of the DPW, and I've transferred the responsibility for trash in parks and playgrounds from Parks Department to refuse division of DPW. There's some budgetary reasons behind it. Right now, we're, like all city departments, the parks and playgrounds folks are way understaffed. They have 4 people doing what like 12 used to do at one time. And they were spending the equivalent of 3 days a week of full-time employees picking up trash. And so by transferring that responsibility to the refuse division, that's now going to free up those parks and playground workers to be doing what we really would like them to be doing, which is mowing the grass and trimming bushes and keeping the park clean and keeping the playgrounds well maintained. So that's the first step that brings, now we have refuse employees specifically assigned to parks, playgrounds, and ball fields. Those employees, along with the senior building custodians of all the schools, the entire school department grounds crew, our city parks department, our city DPW, I think that's most of them, along with the custodians at the library and city hall also. Last Thursday, all underwent training in proper handling and disposal of hypodermic needles. So everyone was trained last Thursday. They've all been issued gloves and sharps containers, and their job duties now include, while they're out cleaning, picking up trash, cleaning parks, ball fields, playgrounds, schoolyards, that their responsibility has been expanded to proactively be looking for hypodermic needles that may be there and removing them immediately and properly, and they've been trained and equipped to do it. That gives us a lot of people on a daily basis looking around the ball fields, the playgrounds, and the parks. We added, as a result of my becoming aware of the issue that was raised here last month, we've added school bus stops to that. And the school department has, last week, provided the refuse division with the locations of all of the school bus stops. So they will be on the route along with the parks and playgrounds and ball fields to be checked regularly to be cleaned in general, but specifically to be also be looking for any improperly discarded needles. So it's an issue, but we're acknowledging it's an issue and we're doing something about it. So that's the proactive step. The reactive step that would come into play when you come across a needle or needles that we didn't find before you found it is we've set up a hotline telephone number, 508-583-2323. And that goes directly into the Brockton Fire Department dispatch office. And we will be, I was actually introducing this to you first here tonight, we'll be beginning a campaign to publicize that phone number. 508-583-2323. That will get you right into a fire department dispatcher. You tell them that you've come across a needle or needles and you'd like to have them removed. And depending on the time of the day or the day of the week, they will dispatch either a City of Brockton refuse department worker if it's during regular work hours, Monday through Saturday. If it's nights and weekends, Jeff Jacobson is here from Brewster Ambulance. Brewster Ambulance has agreed to remove the needles on nights and weekends when our refuse workers are not working. And I think this is a really important piece of it, because a couple of the instances that I've been made aware of is like on a Saturday morning at a football field and the youth football team comes out to play and they find a needle in the football field. And now every parent in the place is worried that there's another one out there. And I get that. For those of you who don't know me, I'm a father of 6. 5 of the 6 went completely through the Brockton Public Schools. So I have a long track record, and I now have a grandson in the Brockton Public Schools. So my kids are growing up now, but now I'm with grandchildren, but I understand how a parent feels and how a parent does not want the child exposed to these things. No more than I want my grandson exposed to them. So this Brewster Ambulance piece is very important to us. One of the things Brewster has done since coming into the city on July 1st is they've, over and above the regular ambulances they provide, at no charge to the city, they're providing what's called a community support vehicle. I saw it parked outside, so Jeff's driving it tonight. And that community support vehicle is offering and available to do a lot of community health outreach, some things we've already started, already involved in mobile prescription drug take-back. Doing another one on, I think, October 30th, out picking up unused prescription drugs at the senior high-rises and the Council on Aging. Yeah, they're doing blood pressure clinics. They're doing some really neat community health outreach at no additional charge to the city. So when I went to Jeff with this and said, can you cover us on picking up needles when our people aren't working? They agreed to do it. They're not charging the city anything to do it. So that's why we're having the phone call go into fire department dispatch. The improperly discarded needles, in my opinion, are not the problem. They're a symptom of the problem. The problem is heroin addiction.
Yes.
And so the needle thing is it's a symptom of this much larger problem that we have, but I agree that it's also a public health issue and a public safety issue. We don't want someone getting poked by one of these things that's been improperly discarded. So we are acknowledging it's an issue, we're taking it head on. We've assigned resources to try to proactively find these things in parks and playgrounds and school bus stops and ball fields, knowing that we're not going to find all of them, but that if we're going to find as many as we can, and if someone else finds one, we've set up a phone number that works 24 hours a day, 7 days a week. So really we've got this 3-tier approach to taking this on now. The proactive side of now having personnel assigned and trained and equipped to be looking for these in the places that are most vulnerable, parks, playgrounds, ball fields. I don't want parents hesitating to bring their kid to play ball or to go down and enjoy the playground because they're afraid they're going to come across one of these. So we're looking at all those places every day. Parks and playgrounds on average will be checked about every other day the way we've got the rotation set up. So it doesn't mean they can see everyone, doesn't mean they're going to find everyone, doesn't mean someone might not throw one there an hour before you get there. But we're going to be trying to intercept as many of these as we possibly can. And for the ones that we don't find first, we've got a hotline number and trained personnel that 24/7 will be right out within 10 or 15 minutes to come get it. And you won't have to even think about handling it yourself. And we do have, for people that want to responsibly dispose of them, we've got that mechanism set up also. And the part I wanna thank you for is, reminding me to think about school bus stops specifically, because as we were putting this together over the last few months, honestly, we really hadn't had school bus stops in the conversation until I heard the issue raised here last month, and I said, that's important. So we've added actually school bus stops and back bus stops both to the places we're gonna be proactively looking for them. So I can't guarantee you'll never run into one, but I think it'll be a lot less likely now, and if you do, get a phone number to call and we'll get rid of